Sorry to keep you waiting for a few minutes, and this is primarily an opportunity for me to give a little casual summary of some of the things I worked on in Washington, a little flavor to it, give you an opportunity to ask any questions. So this is not a formal presentation on any particular subject, but I do think it's important to come back and report after 5 days of hard work in Washington in behalf of the people of Arkansas to give a little bit of summary of it. And first, I am chairman of both the Oil and Gas Compact Commission and the Southern States Energy Board, and so I convened a Governor's Summit, Governor's Energy and Infrastructure Summit, which was well attended by most of the southern states. And we had a strong representation from Arkansas looking at security issues, but also opportunities for us in Arkansas in terms of more energy consumption in the Northeast that might help us in the market here in this state. We talked about the security issues as well as cybersecurity and the necessity for that in terms of the energy grid. That led into the National Governors Association and my work on health care. And this is probably the most important topic that I engaged in Washington. And to set the stage, it was preceded by multiple conference calls with governors from across the country in which we were trying to reach a consensus on recommendations to the administration on the direction of the replacement for the Affordable Care Act. And we have circulated white papers, we've reformed those. It focuses on flexibility for the states in terms of block grants or per capita grants that would be given, or the status quo. It focuses on additional tools the states can use so that we don't have to go back to Washington for 1115 waivers. What we're focusing on is not how we obtain more waivers to accomplish health care in Arkansas, but how we should have broader reform at the federal level. Following those conference calls with the governors, we were in person meeting in Washington. I met on 2 different occasions with the Vice President, 2 or 3 occasions with the Secretary Tom Price at DHHS, and conveyed our thoughts as governors, but also we heard from the administration on what they have to go through and the steps and the timing of it. And so based upon all those conversations, I'm very interested in the President's message tonight to the nation. We're watching it closely, and the governors have deferred releasing our plan to the President's State of the Union address to see what message he has on health care, and then we can follow it up with a more detailed discussion of the governors and the alternatives that we want to present to the United States Congress. What's important from an Arkansas standpoint is that I see Arkansas Works strengthened and not jeopardized. People worry about their health care, and I've made the point to the administration and to Congress that, as you know, we started out with 250,000 estimate for the expansion population. That's now gone up to 330,000. There's some logical and explainable reasons for that, but at the same time, it's a bigger cost curve than what was anticipated at the beginning, not just for Arkansas, but for the federal government as well. And so we are asking for tools that will allow us to strengthen the reform of Arkansas Works, and secondly, to have a better cost control for the federal government and for the states in terms of Arkansas Works. And that can be done very simply from the state standpoint. The key for all the reform that we want to accomplish, from work requirements to being able to control the numbers and to make sure that it's being utilized for those that are moving up the economic ladder and as a safety net. The key is the partnership that we have with the federal government, and the funding stream that comes from the federal government is a critical part of it. That's not to say that they should not save money, and they need to save money, but we have to continue the partnerships with the states to make this successful. And so that remains to be determined. They had a preliminary draft out from Congress that indicated in one part of it that there could be some cuts in the federal participation in the expansion funding. They quickly said that's not final. We're still debating that. And my message to Washington has been that we do not want to leave all of the financial burden on the federal government. You have to curtail your cost. You have to reduce the cost curve and the growth of the cost in the Medicaid expenditures. At the same time, the state needs to do the same thing, and the state cannot be left with all the burden from the federal government. And so it's got to be a continued participation from a funding standpoint, partnership between the federal government and the state government in order to make this work. So I expect, in terms of timing, that there will be some clarity within the next 6 to 8 weeks on this. Certainly, I expect to have a more specific plan that we can release to the public, but those are the broad outlines of it. But it is important that Arkansas understands that I expect Arkansas Works to continue. I expect it to be strengthened in terms of reform, and I expect that it will produce cost savings that will help both the federal government and the state to manage the health care access that is so important. In addition to the meetings with Secretary Price, I met with Majority Leader Kevin McCarthy on the House yesterday. I met with Senator Lamar Alexander on the Senate side. We met with the chairman of the House Commerce Committee, as well as the chairman, my colleague, former colleague, Kevin Brady of Texas, chairman of the House Ways and Means Committee, all the key players in terms of where the Congress goes. And we conveyed to Congress our concerns, our desires, and how the state is willing to continue that partnership. So those are a couple of things in reference to my trip there that was particularly important. I was able to talk trade issues with the President. We talked health care with the President. We talked immigration with the President, as well as with some of his key administration officials. It gives me a higher level of confidence whenever I see how the President is managing. He is the CEO. He is giving directions to his cabinet as to what he wants to accomplish, and counting on them working with Congress to get that job done. I saw him personally holding people accountable, and I expect results from that. They're working very hard. It was a good occasion to meet the Secretary of Treasury, OMB Director, as well as many other administration officials. With that, I'm delighted to be back in Arkansas and get back to work with the legislative session, sign a few bills today, and look forward to continuing that work with the General Assembly. With that, I'll be happy to turn over any questions.
Governor, yesterday you signed proclamations setting execution dates for 8 inmates. The schedule that you set under this, you had 8 executions under a 10-day period. It's been, I think, quite some time since the state has executed that many people within a month. What makes you comfortable with the state moving forward with such a, I guess, aggressive schedule for executions, and also what's the current status for finding a new supply of the drug that expired in January?
I don't anticipate a problem in the procurement of the drugs that are necessary. In terms of the timing, it's not my choice. It's something that was left on my plate when I became governor. We've not had executions, is it in more than 8 years. I believe it's close to 10 years. And because of that, there's been a backlog, if you will. There's been a larger number than normal that have not received their review from the courts, and now all that's been completed since I've been governor, because if you remember, whenever we started setting the execution dates at the beginning when I was governor, I was asked the question, why are you doing this? We haven't set execution dates in a long time. You know it's going to be challenged. You know what my answer was? If we do not set the execution dates, that will not trigger a review and will never bring finality to this long and arduous process that really is so difficult on the victims and their families. And so setting the execution dates is what has brought us to the Supreme Court review, and they did not grant certiorari, affirmed the Arkansas Supreme Court, who issued the mandate, and the Attorney General acted upon that and sent the list over to me. As governor, I was sworn to faithfully execute the laws. My job is to set the dates, and I did that. I would love to have those extended over a period of multiple months and years, but that's not the circumstances that I find myself in. And again, the families of the victims that have endured this for so many years deserves a conclusion to it.
Is there a concern about doing double executions like this could open the door for problems to occur or stress on corrections staff doing this?
I have raised that issue with our Director of Corrections, Wendy Kelly, asking what is best for their personnel, and knowing how difficult this is, and the answer is it's not any easier to string it out over 4 or 5 months than to do it in a measured and separated fashion, but in the sequence that we have outlined. Mr. Brummett.
Are you crossways with the NRA on whether there should be additional training before we have carry on college campuses?
I'd like to think I'm not crosswise with the NRA. We've always had a very good relationship, and I've visited with them while I was in Washington about this legislation in Arkansas, and I reiterated some findings that I made for the NRA after the Sandy Hook Elementary School shooting. And the finding was that, first of all, there should be some local options as to how they implement protections of trained personnel and firearms in the school. And the second one was that they be trained. And that was the main point of that study, was what kind of training is needed for armed personnel in the school system. And these are teachers and their staff. They're not students, there's teachers and staff. And so we implemented that. And so there were 2 principles, local control and training. I've compromised on the local control issue because of the compelling interest in Arkansas about having that Second Amendment right even on a university campus, but I held fast on the training aspect of it. And so we've worked through this, we've made some compromises, but the training I still maintain is important. So this is an Arkansas issue, it's not an NRA issue. Although I have great respect and working relationship with them. I expect the legislature to work through this. Hopefully we can reach agreement on it, but that's part of the process.
Would you sign a campus carry bill if it came to your desk without a training requirement?
I'm going to wait and see how the legislative process goes. I've expressed my support for a training requirement, but let's see. They're still working on it. They might come up with different ideas that satisfy me, but let's just wait and see.
Governor, do you support a bill to rename the Clinton National Airport? And do you see this as a type of decorum that's appropriate in Arkansas for political leaders in the past?
Well, it's more, it's appropriate in terms of naming a facility in Arkansas that it be done by the people who own the entity. And so in this case, we have the Little Rock Airport that is owned by and directed by the directors that have been appointed for that. They have named it the Bill and Hillary Clinton Airport, and I respect that decision, and I don't believe the legislative body should interfere with that.
Do you think this reflects fall in popularity or fall from grace for the Clintons in Arkansas that this has come up?
No, you'd have to ask the sponsor of the legislation as to his thinking on it, and I actually did read, I don't think there are names in the legislation, but I think we know how it is directed. So you'd have to ask him that. I think it's him. Even today, I was at the mansion with some guests from a foreign country, and I was with great pride pointing out the balcony in which Bill Clinton made one of his announcements for president. And so it's a connection that we have that we're proud of, and we're certainly delighted to have the Clinton Presidential Library here in Little Rock.
Governor, you mentioned in discussing your conversations with Director Price on Arkansas work, you said that there was some possible cost savings. Do you have any details of that, or do you know where those cost savings will come from?
Yes. First of all, it's the number that I'm concerned with. And the previous administration did not give us the flexibility to manage the numbers, and this is what has happened. The number of employees that moved, number of workers that moved from employer-sponsored insurance onto the Medicaid expansion is problematic. But the previous administration did not give me the flexibility to manage that. The other part of the number is the cost, the percent of the federal poverty level that's eligible for the Medicaid expansion. Right now, it is up to 138% of the federal poverty level, and it's locked in. You have no flexibility there. Well, our economy, our reform in this state could suggest that we can reduce that number to 100% of the federal poverty level, and you immediately get the numbers under control, and you can shift the others over to the exchange that is underserved and underutilized, and they would still have the access to health care insurance, but you would be able to control the number, the cost of the state, and the cost of the federal government, because it's less on the exchange, and it moves them up that economic ladder. So those are two simple things that will help us to control the cost, and it will save the federal government money. I presented to the previous administration a simple fix that would save them money even under the existing restrictions on numbers, and that was turned down. So there's ways to control those costs. There's other ways to do it, but you have to give the states the flexibility to do it. Yeah, let's go here first.
Do you support a bill to allow charter schools the first right of refusal on unused or underutilized public school buildings?
In general principle, yes. I think the bill is aimed at the problem that was in Helena, West Helena, where you had public school buildings sitting idle and rusting and in disrepair and not used, but the school district would not sell them to a charter school. That is unacceptable. It's been corrected, but for 2 years the buildings were unused and going into disrepair. Now, that's one district, and so you have to look at the legislation as to whether there's any other consequences that could be problematic. I'm very sensitive to Little Rock School District and their financial needs, and I want to be able to hear from Commissioner Key and Michael Poore, but structurally and philosophically, I think that is the proper use of public facilities, because both the traditional public schools and the charter schools are paid for by taxpayers. So let's efficiently use them between those entities. And so I want to look at it as to problems. I want to listen more, but philosophically, I think that's a bill that needs to continue the debate in the General Assembly.
But what about the local control issue that that some of the people who are opposed to the bill bring up, that this is actually taking local control away from the school boards in how they decide how the facility will be used.
Well, I think that's a factor to be considered in it. Yes, that is a factor to be considered. But we are guardians of taxpayers' dollars. And if I have two universities, or I have a university and a two-year college that's not properly sharing resources, there's something wrong with that, and don't have the right sharing of school credits and transfer students. I expect my Department of Higher Education to improve that coordination. We're simply looking at ways to improve the coordination between the public traditional districts and the charter schools that are all funded by public dollars to make sure they work smoothly together, and facilities is a part of it. We're looking at this budget cycle, we're putting in $100 million of state money into facilities. 10 years from now, do we want a local school district hoarding a facility because they don't want someone else to use it? I think there is a responsibility of the state to make sure those dollars are effectively used. Yeah, we had John first.
Those comments, the recent comments by the White House press secretary about the federal government possibly stepping up enforcement of marijuana laws, do those concern you, that Arkansas might be headed for conflict with the federal government on the issue of marijuana?
I think you need to not overanalyze the statements of the press secretary on that particular point. I think the one that you need to pay attention to is Attorney General Sessions. I did meet with him, and I know him. We were U.S. attorneys together back in the 80s, and I would expect that there will not be any reevaluation of medical marijuana in the states, but I would expect that there will be a reevaluation of the recreational use, and I don't know how that will be determined, but I expect that the Attorney General will take a second look at the Obama administration policies on recreational use.
Governor, I have a question regarding health care. A recent study came out ranking Arkansas the worst state in the country as far as health care, whether that be access to preventative measures, people having access to care in general. Do you think with the discussions that you had on Arkansas works that would lead to any progress in that area potentially?
Yes. I mean, one, we've clearly improved access, and while there's a lot of different rankings out there, when you look at improved coverage of health care to our citizens, Arkansas has moved up dramatically. And that's partly because of Medicaid expansion and the improved access. Certainly, Arkansas works whenever it is implemented in the right way with the right reforms, is desired to have a healthy outcome. For example, we want to incentivize annual checkups, and that's one of the things that we're putting into play, is incentivizing dental coverage if you do take the proper steps in manage your own health care. So we're taking a number of steps to improve health care outcomes in Arkansas. We want to continue to focus on that, and that combined with our Healthy Active Arkansas program, which is very important, hopefully will improve those health statistics.
Governor, you had mentioned that you're looking forward to hearing what the President has to say tonight at his address to Congress. Just curious, what do you make of the President's first month or so in office, and what do you think he'll say tonight? He says a lot of stuff.
You know, it's interesting just in terms of style of the President's message tonight. I would not expect it to be a campaign type speech. I would not expect it to be like the speech that he gave to CPAC, the Conservative Political Action Group. I expect it to be more of a traditional, in a Donald Trump style, message to Congress. I expect him to use a teleprompter. I expect him to, I know that they've worked on it very hard, and that he's going to talk about health care. He's clearly going to be talking about our challenge with terrorism, and he'll be talking about his budget, which he has already indicated is increasing spending on defense, which is very appropriate. There's going to be some cuts in there as well on the discretionary spending. So I expect it to be a very informative speech, setting out his goals. It's not going to, we're not going to learn how we're going to accomplish the replacement and reform of the Affordable Care Act, but I do expect him to outline that process as to how we get there. We're going to learn some things from him, but I'm hopeful to see a speech that, in which is very important, that helps bring our country together and that does not divide us. And that's both in terms of rhetoric, but also just in terms of the tone that he gives that hopefully will be a unifying message tonight.
Just going back to the question, what do you make of his first month in office?
I think his appointments have been excellent. I've met his cabinet. I like what they're doing. They're working hard. I like his Supreme Court nominee. I think he's got a good team that's in place. I've been encouraged that he listens to them. Obviously he's meteoric. He is unpredictable in the way he conducts himself. And I think the American people finds that to a certain extent appropriate, and just like he campaigned. Whenever you see some of his close staff talking about the deconstruction of the regulatory state in Washington, I think that resonates. I think his emphasis upon turning back regulations has helped us in the business community to have more confidence. And so I think it's been well received. I think where it's challenging is that, he's made some missteps in terms of the first executive order on foreign visitors to our country. That was not well done, and that there's a cost to that. But he's learning as he goes through that, as the importance of the team and how he's got to rely upon his leadership in Congress to get some of his proposals done as well.
I was just wondering, last week, Senator Garner described his amendment as a deal, a compromise with yourself, Senator Hendren, Senator Hutchinson, and Mr. Collins. This week, he comes back and says he's taken crap from his district, so he no longer supports it. Was he just be scared off by the NRA, or do you think that support for your compromise just dried up in the Senate?
Well, I'm a little bit at a disadvantage because I haven't had some of those discussions. I've been out of town, but I think it's just the process of the legislation, the compromise, as he described it, that was reached, did not get met with uniform favor. And so I think he's saying, let's take a breath on this. Let's see if there's some other areas that we can get this done. And I expect that's what the Senate committee will look to or look at. So let's just see how it develops. I think it's very uncertain as to where this goes, and it might be that we decide to study this for 2 years and see if we can't come together and address it down the road.
Is that what you hope?
No, that's. I would like to have a bill on my desk that I like and that I can sign. Thank you all very much.